One of the most important jobs your kidneys perform every single day is producing and regulating urine. Because of this, changes in urination are often among the earliest signs that something may not be functioning properly. Unfortunately, many people overlook these changes or assume they are simply the result of aging, drinking more water, stress, or temporary health issues. In reality, your bathroom habits can reveal a great deal about your kidney health. A common warning sign is an increase in how often you urinate, particularly during the night. Waking up once occasionally may not be unusual, but repeatedly getting out of bed several times every night can indicate that your kidneys are struggling to properly concentrate urine. As kidney function changes, the body's ability to regulate fluids becomes less efficient, leading to more frequent trips to the bathroom. Over time, this can disrupt sleep quality and contribute to daytime fatigue. On the other hand, some individuals experience a noticeable decrease in urine output. Even when drinking normal amounts of fluid, they may find themselves producing much less urine than before. This can occur when the kidneys are unable to effectively filter blood and remove waste products. Reduced urine output should never be dismissed, especially when accompanied by swelling, fatigue, or other unusual symptoms. The appearance of urine can also provide valuable clues. Healthy urine is generally light yellow and relatively clear. Dark-colored urine may indicate dehydration, but when the problem persists despite adequate hydration, it can signal underlying kidney issues. Cloudy urine may suggest infection, inflammation, or the presence of abnormal substances that should not be there. Any persistent change in urine color deserves attention. Another important warning sign is foamy urine. While a small amount of foam can occur occasionally due to the speed of urination, persistent foamy urine may indicate excess protein in the urine. Healthy kidneys normally prevent large amounts of protein from escaping into the urine. When the filtering units become damaged, protein can leak through, creating a foamy or bubbly appearance. This symptom is often one of the earliest indications that kidney filters are under stress. Blood in the urine is another signal that should never be ignored. Sometimes the blood is visible, turning the urine pink, red, or brown. In other cases, it may only be detected during laboratory testing. Blood in the urine can result from kidney disease, kidney stones, urinary tract infections, or other serious conditions that require medical evaluation. Some people also notice discomfort or pressure while urinating. Burning sensations, difficulty starting urination, interrupted flow, or a feeling that the bladder never completely empties may indicate problems involving the kidneys or urinary tract. Although these symptoms do not always point directly to kidney disease, they warrant proper investigation. Changes in urination often develop gradually, making them easy to overlook. Because these changes may appear long before more severe symptoms develop, paying attention to urination patterns can provide an early opportunity to identify potential kidney problems and seek appropriate medical evaluation before significant damage progresses further. Feeling tired from time to time is a normal part of life. Busy schedules, poor sleep, stress, and physical activity can all leave a person feeling exhausted. However, when fatigue becomes constant, overwhelming, and difficult to explain, it may be your body signaling a deeper problem. One of the lesser known but significant signs of declining kidney function is persistent fatigue and weakness that does not improve with rest. Healthy kidneys do much more than filter waste from the blood. They also help regulate several important functions that affect energy levels and overall health. One of these functions involves producing a hormone called erythropoietin. This hormone sends a signal to the bone marrow, instructing it to create red blood cells. Red blood cells are responsible for carrying oxygen from the lungs to tissues throughout the body. When kidney function begins to decline, the production of erythropoietin may decrease. As a result, the body may produce fewer red blood cells, leading to a condition known as anemia. With fewer red blood cells available to transport oxygen, muscles, organs, and the brain may not receive the oxygen they need to function efficiently. This can create a persistent feeling of tiredness that goes far beyond ordinary fatigue. People experiencing kidney-related fatigue often describe it as a heavy exhaustion that remains present throughout the day. Even after a full night's sleep, they may wake up feeling unrefreshed and lacking energy. Simple daily activities that once felt effortless may suddenly seem challenging. Walking upstairs, carrying groceries, doing household chores, or completing work tasks may require noticeably more effort than before. Weakness often accompanies fatigue. Muscles may feel less powerful, endurance may decline, and physical performance may suffer. Some individuals notice that they become tired much more quickly during exercise or routine activities. Tasks that previously required little effort may leave them feeling drained and needing extended periods of rest. Mental fatigue can also develop alongside physical exhaustion. The brain relies heavily on a steady supply of oxygen to function effectively. When oxygen delivery is reduced, concentration, memory, and mental clarity may suffer. People may find it harder to focus on conversations, complete complex tasks, or remember important details. They may describe feeling mentally foggy, distracted, or unusually forgetful. As kidney function declines further, waste products that would normally be removed from the bloodstream can begin to accumulate. These toxins may contribute to feelings of sluggishness, low motivation, and reduced mental alertness. The body essentially has to work harder to maintain balance, placing additional strain on various systems. Many individuals mistakenly attribute these symptoms to aging. They may assume that feeling constantly tired is simply a normal part of getting older. Others blame stress, long work hours, or lack of exercise. Because fatigue is such a common complaint, the possibility of kidney involvement is often overlooked until other symptoms begin to appear. Persistent fatigue becomes especially concerning when it develops alongside additional warning signs such as swelling in the legs, changes in urination, high blood pressure, dry itchy skin, shortness of breath, or unexplained weakness. When several of these symptoms occur together, they may indicate that the kidneys are no longer functioning as efficiently as they should be, affecting multiple systems throughout the body. Swelling in the feet, ankles, legs, hands, or even the face is one of the most noticeable physical signs that your kidneys may not be functioning properly. While occasional swelling can occur after standing for long periods, eating a salty meal, or traveling for many hours, persistent or unexplained swelling should never be ignored. It often reflects changes happening deep inside the body, particularly involving the kidney's ability to manage fluids and maintain balance. Healthy kidneys constantly filter excess water and waste products from the bloodstream. They carefully regulate how much fluid remains in the body and how much is removed through urine. This process helps maintain proper blood volume, blood pressure, and tissue hydration. When kidney function begins to decline, this delicate balance can be disrupted. Excess fluid that would normally be eliminated may start accumulating in the body's tissues, leading to visible swelling known as edema. The feet and ankles are often the first areas where swelling becomes noticeable. Gravity naturally pulls excess fluid downward, causing it to collect in the lower parts of the body. People may notice that their shoes feel tighter than usual, or that their socks leave deep marks around their ankles. By the end of the day, the swelling may become more obvious, especially after spending long periods standing or sitting. As fluid retention increases, swelling can extend into the lower legs and calves. Some individuals describe a feeling of heaviness or tightness in their legs. The skin may appear stretched, shiny, or slightly discolored. In some cases, pressing a finger into the swollen area leaves an indentation that remains visible for several seconds before slowly returning to normal. The hands can also become affected. Rings that once fit comfortably may suddenly feel tight or difficult to remove. Fingers may appear puffy, making it harder to grip objects or perform tasks requiring fine motor skills. Many people initially attribute these changes to heat, aging, or temporary water retention, not realizing that their kidneys may be struggling to remove excess fluid. Facial swelling is another important sign. Some individuals wake up with a noticeably swollen face, particularly around the eyes and cheeks. While facial puffiness can result from lack of sleep or allergies, persistent swelling may indicate fluid imbalance associated with declining kidney function. The face may appear fuller than usual, especially in the morning hours. Fluid retention can affect more than appearance. Excess fluid places additional strain on the heart and circulatory system. As the volume of fluid in the body increases, blood pressure may rise, creating further stress on already vulnerable kidneys. This creates a cycle in which kidney dysfunction contributes to fluid retention, and fluid retention places greater demands on the kidneys. In some cases, fluid accumulation can extend beyond the limbs and face. Fluid may begin collecting in the abdomen, causing bloating and discomfort. People may notice unexpected weight gain over a short period despite no significant changes in diet or activity level. This weight gain often reflects retained fluid rather than increased body fat. The severity of swelling can vary greatly from person to person. Some individuals experience mild puffiness that develops gradually over weeks or months, while others notice more rapid and significant changes. Because swelling can result from several medical conditions, including heart disease, liver disease, circulation problems, and kidney disorders, persistent edema should always be evaluated carefully, particularly when it occurs alongside changes in urination, fatigue, high blood pressure, or other warning signs that may point toward declining kidney function. Puffiness around the eyes is a symptom that many people overlook because it can seem harmless or purely cosmetic. Most individuals assume it is caused by lack of sleep, stress, allergies, aging, or simply waking up in the morning. While these factors can certainly contribute to temporary swelling around the eyes, persistent puffiness may be an early warning sign that your kidneys are not functioning as effectively as they should. In some cases, it may even appear before more obvious symptoms of kidney problems develop. The kidneys play a crucial role in filtering waste products and maintaining the proper balance of fluids and proteins within the body. One of the kidney's most important functions is preventing essential proteins from escaping into the urine. Proteins such as albumin help keep fluid inside blood vessels where it belongs. Healthy kidney filters are designed to allow waste products to pass through while retaining valuable substances like protein. When these filtering units become damaged, protein can begin leaking into the urine. This condition, often referred to as proteinuria, may occur during the early stages of kidney disease. As protein levels in the bloodstream decrease, fluid balance becomes disrupted. Without sufficient protein to hold fluid within blood vessels, some of that fluid can move into surrounding tissues, causing swelling in various parts of the body. The skin around the eyes is particularly thin and delicate, making it one of the first areas where fluid accumulation becomes visible. Even small changes in fluid balance can lead to noticeable puffiness beneath or around the eyes. Many people observe this swelling when they first wake up in the morning because fluid tends to redistribute throughout the body while lying down during sleep. Unlike temporary puffiness caused by fatigue or allergies, kidney-related swelling often becomes a recurring issue. It may appear frequently, persist for extended periods, or gradually worsen over time. Some individuals notice that their eyes consistently look swollen despite getting enough sleep and maintaining healthy daily habits. Others may find that the puffiness becomes more pronounced from week to week. The swelling may affect both eyes equally and can create a tired or aged appearance. The lower eyelids often appear fuller than usual, and the area beneath the eyes may seem heavier or more pronounced. In some cases, people notice changes in photographs before they recognize the symptom in everyday life. Because puffiness around the eyes is often dismissed as a minor cosmetic concern, many individuals delay seeking medical evaluation. They may spend months trying different skincare products, allergy medications, or lifestyle adjustments without realizing that the underlying issue could involve kidney function. This delay can allow kidney damage to progress unnoticed. Puffiness around the eyes rarely occurs in isolation when kidney disease is involved. It may be accompanied by other warning signs such as foamy urine, swelling in the feet and ankles, fatigue, high blood pressure, changes in urination patterns, or unexplained fluid retention. When several of these symptoms appear together, the possibility of kidney dysfunction becomes more significant. Age can also make the symptom more difficult to interpret. As people grow older, natural changes in skin elasticity and fat distribution can create a puffy appearance around the eyes. However, sudden or persistent swelling that develops beyond normal aging patterns deserves attention, especially when it appears alongside other health concerns. The eyes often provide valuable clues about what is happening inside the body, because the tissue surrounding them responds quickly to changes in fluid balance. Persistent puffiness can serve as an early visual signal that the kidneys may be struggling to maintain the delicate balance of proteins and fluids necessary for healthy body function. Dry, itchy skin and frequent muscle cramps may not seem related at first glance. Many people assume these issues are caused by weather changes, dehydration, aging, poor circulation, or nutritional deficiencies. However, when these symptoms become persistent or occur together, they can sometimes indicate that the kidneys are struggling to maintain the body's delicate internal balance. Because the kidneys play a vital role in regulating minerals, fluids, and waste products, even a small decline in kidney function can affect the skin, muscles, and nervous system in noticeable ways. Healthy kidneys do much more than remove waste from the bloodstream. They help regulate important minerals such as calcium, phosphorus, potassium, sodium, and magnesium. They also assist in maintaining proper hydration and support the production of hormones that contribute to overall health. When kidney function declines, these carefully controlled systems can become disrupted, leading to a variety of symptoms that may initially appear unrelated. One of the most common complaints among individuals with declining kidney function is dry skin. Healthy skin depends on proper hydration, balanced mineral levels, and adequate circulation. When the kidneys are unable to maintain these conditions efficiently, the skin can lose moisture and elasticity. As a result, it may begin to feel rough, flaky, tight, or unusually dry. Many people notice that lotions and moisturizers provide only temporary relief because the underlying issue is occurring inside the body rather than on the skin's surface. Persistent itching can be even more concerning. Kidney-related itching often differs from ordinary skin irritation. It may affect large areas of the body rather than a single location and can occur without any visible rash. Some individuals describe the sensation as deep, intense, and difficult to ignore. Others experience itching that becomes worse at night, interfering with sleep and reducing overall quality of life. One reason this itching occurs is the buildup of waste products in the bloodstream. Healthy kidneys continuously remove toxins that the body no longer needs. When kidney function declines, these substances can accumulate and contribute to skin irritation. In addition, imbalances involving phosphorus and other minerals may further aggravate itching and discomfort. Muscle cramps are another symptom that may develop when kidney function is impaired. Muscles rely on a precise balance of electrolytes to contract and relax properly. The kidneys play a critical role in regulating these electrolytes, including potassium, sodium, calcium, and magnesium. When the balance becomes disrupted, muscles may begin to behave abnormally. Many individuals experience cramps in the legs, calves, feet, or toes, particularly during the evening or while sleeping. These cramps can range from mild discomfort to severe pain that abruptly wakes a person from sleep. Some episodes last only a few seconds, while others continue for several minutes and leave lingering soreness afterward. In addition to cramps, people may experience muscle twitching, spasms, or a sensation of restlessness in their legs. These symptoms can make it difficult to relax, sit comfortably, or maintain uninterrupted sleep. Over time, repeated sleep disturbances may contribute to fatigue, reduced concentration, and lower energy levels throughout the day. The combination of dry skin, persistent itching, and muscle cramps can easily be mistaken for separate minor problems. Many people attempt to treat each symptom individually without realizing they may share a common underlying cause. Because these symptoms often develop gradually, they may be overlooked until additional warning signs begin to appear. When dry skin and muscle cramps occur alongside fatigue, swelling, changes in urination, high blood pressure, or puffiness around the eyes, they may provide important clues that the kidneys are struggling to maintain the balance necessary for healthy skin, muscles, nerves, and overall body function. High blood pressure and shortness of breath are two symptoms that can have many possible causes, but they are also closely connected to kidney health. Because the kidneys play a major role in regulating blood pressure and maintaining fluid balance throughout the body, problems affecting these organs can eventually influence the cardiovascular and respiratory systems as well. In many cases, people are surprised to learn that their kidneys may be contributing to symptoms they initially associate with the heart or lungs. Healthy kidneys help control blood pressure by regulating the amount of fluid in the bloodstream and producing hormones that influence blood vessel function. Every day, the kidneys carefully balance sodium, water, and other substances to keep blood pressure within a healthy range. When kidney function begins to decline, this balance can be disrupted. Excess sodium and fluid may remain in the body, increasing the volume of blood circulating through the vessels. As blood volume rises, pressure against artery walls can increase. High blood pressure is both a cause and a consequence of kidney disease. Elevated blood pressure can damage the tiny blood vessels inside the kidneys, reducing their ability to filter blood effectively. At the same time, damaged kidneys can contribute to worsening blood pressure control. This creates a cycle in which kidney dysfunction and hypertension continuously reinforce one another. Many people with high blood pressure experience no symptoms at all. For this reason, hypertension is often called a silent condition. Some individuals may develop headaches, dizziness, blurred vision, or feelings of pressure in the head, but many remain unaware of their elevated blood pressure until it is discovered during a routine examination. When blood pressure remains uncontrolled for long periods, it can place tremendous stress on the kidneys, heart, brain, and blood vessels. As kidney function declines further, excess fluid retention can become a significant problem. Instead of being removed through urine, extra fluid may accumulate throughout the body. Swelling in the feet, ankles, legs, and hands is often one of the earliest signs of this process. However, fluid accumulation can also affect less visible areas, including the lungs. When excess fluid begins collecting in or around the lungs, breathing may become more difficult. Individuals may notice shortness of breath during physical activity that previously caused no problems. Walking upstairs, carrying groceries, or engaging in moderate exercise may leave them unusually winded. Over time, breathing difficulties may occur with increasingly minor exertion. Some people notice that they become short of breath when lying flat. They may need additional pillows to sleep comfortably, or feel compelled to sit upright to catch their breath. This occurs because fluid distribution changes when the body is in a horizontal position, potentially increasing pressure around the lungs and making breathing more challenging. Shortness of breath can also develop as a result of anemia associated with kidney disease. Healthy kidneys produce hormones that help stimulate red blood cell production. When kidney function declines, anemia may develop, reducing the blood's ability to carry oxygen efficiently. As oxygen delivery decreases, the body may compensate by increasing breathing effort, leading to feelings of breathlessness even when fluid buildup is not severe. The combination of high blood pressure and shortness of breath can significantly affect daily life. Activities that once felt routine may become exhausting. Physical endurance may decline, and simple tasks may require frequent rest periods. Some individuals experience chest discomfort, reduced exercise tolerance, or feelings of weakness as their symptoms progress. Because these symptoms can be associated with numerous medical conditions, including heart disease, lung disorders, and circulation problems, they should always be evaluated carefully. When high blood pressure and shortness of breath occur alongside swelling, fatigue, changes in urination, dry itchy skin, muscle cramps, or puffiness around the eyes, they may provide important evidence that declining kidney function is beginning to affect multiple systems throughout the body.